Hi, Al Jones here again. I have one last thing for you before our back and sciatica workshop that's coming up soon. I've talked about back pain and sciatica and how it can be produced by positions, activities, and everyday life, strenuous or not. And that there is a great chance that it can be reduced or eliminated without taking medication, injections, or having surgery. As a former back pain and sciatica victim, just like you, I have found that the ability to control and manage my pain is very empowering and rewarding on a day-to-day basis. I haven't had a serious episode of back and sciatic pain since my last one in 2003. I was at a back rehabilitation course in Seattle, and while bending over to sign my name on the registration sheet, I felt something happen in the lower region of my back. I made it through the first day of class, but at the end, after sitting all day, I could hardly walk out of there, and I missed the next 2 days. I couldn't leave my hotel room. I couldn't even be treated by the course instructor. One of the class participants had to drive me to the airport and help me with my luggage and get me back on the plane. So I know firsthand and through a lot of training and experience with patients about the debilitating effects of back pain and sciatica. This is the reason for my passion about this, and I don't want to go through that again. There's something else I want to share with you briefly before the workshop, something that will really help you. I think it'll help you understand the nature of back pain and sciatica and how to really deal with it naturally. It doesn't just all happen at once. There are 3 common causes of back pain and sciatica. They are disc degeneration, which starts early in life, arthritis, which starts as we age more, and stenosis, which usually presents itself after the age of 50. I'll use this model to explain what is happening with each of the 3 phases or causes of back pain and sciatica. These were first described by a famous back specialist and surgeon in Canada 4 years ago. And with all the research performed on back pain and sciatica since then, it holds true today. The model is of the last 2 vertebrae of the lumbar spine, the lower back. We call them L4, L5. This is where a lot of the trouble starts in most people with low back pain. The disc is between the vertebrae and is usually the first place of trouble. And this starts about when we're in our 20s. The disc contains water, and that keeps it supple enough to allow movements, to encourage movements and to absorb shock, and stiff enough to act as a stabilizer. As we age, the disc gradually loses water and the space between the vertebrae tends to decrease. The vertebrae collapse on each other. This adds pressure to the joints in the back. And arthritis, back of the spine, and arthritis begins in this space, in this joint, right here. It's called the facet joint. Arthritis begins here. And this is the second cause of back pain. As we age, the arthritis gets worse and the body tends to form new bone to repair the damaged bone, like when we heal from a fracture. The new bone tends to form right where the nerve exits this tunnel from the spinal cord. This nerve at L4-5 innervates our lower limbs. This is the cause of stenosis, this narrowing of the tunnel where the nerve root exits. This is the third cause of back pain, stenosis. 90% of the people we see in our clinic have one or more of these causes of back pain and sciatica. With pressure on the nerve, we start to get tingling, numbness, burning, or pins and needles in the legs. And these are symptoms of sciatica. Have you ever seen older people at Costco and Target leaning over shopping carts while they were waiting to get checked out? This is a common sign of a person with stenosis and sciatica. They get relief from bending over because they bend forward and the spine tends to tilt forward, which opens that tunnel right here, opens that tunnel and relieves their symptoms. In the past, the non-surgical treatments for these conditions have been lumped into one-size-fits-all scheme and not very effective. But the good news is that's all changed. We now can address each problem individually by a process of assessment and classification that identifies exactly what direction treatment should take. This gives a more precise and effective map to recovery. That's why I'm so excited about sharing this with you. I have a feeling that you'll be excited too when you learn more about this and how it can work for you. So I look forward to sharing this exciting information and helping you get back to a pain-free and active life and more joy.